in here. We see down at the bottom, we see the foramen magnum, very little condylar growth at this point in time. Obviously, there's no eruptive teeth, or you wouldn't expect to see eruptive teeth. We don't have a mandible, we just have the maxilla over here with the palatine processes. Here's a base of an occipital bone over here, and it is articulating with a sphenoid bone. That's the earliest point of the spheno-occipital synchondrosis. You told me that you're going to facial growth. If they don't mention that, let me know. Okay, because that's a rather significant aspect of facial growth and development, is this spheno-occipital synchondrosis. Okay, so I thought that would be interesting to bring over. When you're over in the lab, we also have some a child's skull, both from the standpoint of a deciduous dentition and also from the standpoint of a mixed dentition. So those are sometimes interesting to look at to see how and where the skull is at any point in time. Yeah.
If you don't understand what he's talking about, or you can't find it on your skull,
Oh, they
raise
don't
your hand
understand.
and I'll
Or reach your hand. Yes, sir. And a sagittal suture here, just behind it. So we don't see a metopic suture here in this particular adult skull. We see a full frontal bone here. And behind that coronal suture, we see a left and a right parietal bone. And we see the suture in between, not completely fused. So this is, the coronal suture is a little bit more fusion. So not a particularly old individual at the time of death. The lambdoidal suture you see back here. If you'll notice, that there are some, in the suture areas, some of the bones are actually disarticulated from the suture line. And there are two ways of looking at this. There was actually an anatomist named Wormian, right? Dr. Prideaux taught me this one. And Wormian described those bones, but there's some anatomists that talk about them from the perspective that they're Wormian because they get disassociated from the suture line by the suture line itself and separate these tiny bones from the suture line. So these are sometimes referred to as Wormian bones along the suture line. If we look at the lateral aspect of the skull, most of you don't have some of these structures like this little hook here or this spring here. We'll kind of take that off for the moment. But we have a temporal bone over here with its with the mastoid process and the zygomatic process of the temporal bone. Here's the articular tubercle over here, and this ridge in here is the articular eminence just in front of this depression. That is the glenoid fossa, or the mandibular fossa area. Here is a opening in the side of the skull. This is the external acoustic opening over here. Let's see, maybe the back is really over there. And then we still have on this skull the presence of a styloid process. These many times break off these skulls after a short period of time. So styloid processes. So these are all temporal bone portions. I was talking to you this morning that we have, in particular, in this area, we've got a opening here. I'll point it out and then talk about the bones that are surrounding it. This opening here, adjacent to the medial side of the glenoid fossa, this is referred to as the petrotympanic fissure. And it is called petrotympanic fissure because this portion of the temporal bone is petrous portion, but this portion of the temporal bone around the external acoustic meatus is tympanic portion. So those are the two aspects of the temporal bone that create that fissure. If we come over in front of the temporal bone, we have the sphenoid bone. This is the greater wing of the sphenoid bone. And we also have the frontal bone. This line here is created by cutting the calivary off the top of the skull. And then we have the parietal bone. So there's a point here, just adjacent to this little screw in the side of the skull. There's the frontal bone, there's the greater wing of the sphenoid bone, there's the anterior superior aspect of the temporal squama here, and there's the parietal bone. That has this they should talk about when they're talking about facial growth and development in cephalometric radiographs. You can see this area or mark this area on the radiograph. That's called the pterion. That's the point where these four bones come in contact with one another or articulate with one another. So P-T-E-R-I-O-N, pterion. We come back here to where the temporal bone articulates along this suture. That's called the squamosal suture here, and then it comes over to engage this lateral portion of the lambdoidal suture over here. If we come forward from the temporal bone, we have from this articular tubercle, then we have this zygomatic process in the temporal bone, and we have the zygoma. Okay? And the zygoma articulates with its temporal process of the temporal process of the zygoma with the zygomatic process of the temporal bone. And then there's a space here deep to that arch, deep to that zygomatic arch. And what goes through there? You probably know this just from seeing photographs or illustrations in textbooks. What do you think goes through underneath this arch?
Muscle.
Okay, we're going to have a lot of work with this class, I can see already. There is a muscle that sits out here along over the temporal bone, the parietal bone called the temporalis, that comes down to attach to the mandible, that goes deep to this arch. If for some reason this arch is fractured from the outside, it will dig into the temporal bone and to the temporalis muscle, and the temporalis muscle will go into spasm and you won't be able to open your jaw. So you know, sometimes that happens on weekends. Somebody, you know, might have happened this weekend in relation to the Super Bowl. There could have been some bad interactions there. There were definitely bad interactions on the field. But, you know, or let's say a baseball bat, a baseball, something large and solid being thrown into the side of someone's head could easily fracture that zygomatic arch. In the center of this zygoma are usually one or two foramen. These are called zygomaticofacial foramen. These are branches of the zygomatic branch of the maxillary division that come through the zygoma on its lateral side. In the back of the zygoma, it's kind of over. I don't really want you drawing on the skull, so please don't do that, but whoever had this one didn't listen. There's an opening here behind the zygomatic bone. This is the frontal process of the zygomatic bone, and this is a zygomatico-temporal foramen back here. As we come forward, we come into the lower aspect of the frontal bone, and we see there are actually some openings here. Here's one here that's completely surrounded by bone. Here's a notch here, but not an opening. So this is the superior orbital rim. It's a little bulbous in this particular skull. We see a little bit of a notch in the glabellar region. So this is more than likely a male skull. Males will have bulbous superciliary arches, and they will have this bulge over this smooth area or glabellar region of the skull. And they come down over the top of the frontal process of the maxilla and these two bones in the center, which are called the nasal bones. And in the front of the nasal bones, as we were talking about today, with one of these branches of the interethmoidal branch of the nasociliary, there are openings that transmit a nerve called the external nasal to the bridge of the nose. But these openings here, this one is completely surrounded by bone, would be considered to be a supraorbital foramen. This notch here is really doing a similar thing, but we would call this a supraorbital notch. So this is something that isn't consistent from one skull to another. But what's coming around this area is, or through this area, is going to be the supraorbital branch that is coming back into the frontal portion of the ophthalmic division of the trigeminal. So we come from the zygoma and we come to this bone in the front on each side of the nasal aperture. These are maxillas, and the maxillas have a foramen here that goes into the orbit and into a canal. This is the infraorbital foramen and inferior or infraorbital canal, or sometimes referred to as the anterior portion of the inferior orbital fissure. This is the nasal aperture in here, and I don't know how does this show up, this bone over here on the lateral side of the nasal zone. This is the inferior concha, or inferior turbinate bone. And there's one on each side. There's a pair of these bones. If we go up a little bit higher in the back, this bony plate in the midline is the bony portion of the nasal septum. It consists of a lower portion here, that's the vomer, and an upper portion that's the perpendicular plate of the ethmoid. Okay, and then alongside of that is another concha called the middle concha. And it's a little bit hard to see the superior concha. Let's see on this skull. This is kind of an interesting skull. Because it literally totally disarticulates. So here we see a portion, really what's left of the vomer and a piece of the perpendicular plate. If we go in here, we see a inferior concha, a middle concha, and a superior concha. We also see a sphenoid sinus in the back of this area, the nasal chamber. So the reason those two bones are that far back is that there's a cartilage that comes in from the proboscis area of the nose and comes in down the center and articulates with those. That's the nasal septal cartilage. So the nasal septal cartilage goes a good way into the nose to come in contact with the vomer and the perpendicular plate. When there are usually septal deviations, they're caused by banging that anterior aspect of the nose, probably forcing that cartilage into the bones and causing the bones to be disarticulated to one side or the other. Okay, so that's kind of something that sometimes you see if you happen to have a rotation, an internship rotation in a hospital. When you get out of here, you may see that in relationship to facial trauma. So these are people that will many times come into the emergency room, especially on weekends. Okay, so let's see. This aspect here in the midline, a lot of the skulls you have too will have a variety of amount of dentition still in place. Some of these skulls are probably, I'm thinking, probably 40 years old. Okay. Yes.
We can't see anything.
How's that?
Too bright.
Is it too bright? Is that any better?
Yes.
Yes.
So what we see here is the spine sticking out. This would be between the two central incisors, maxillary central incisors. This is called the anterior nasal spine. Okay? Will usually show up even on periapical radiographs that you're taking as a very radio-opaque region above the central incisors. Too much fusion. Talk about that later. So the infraorbital foramens in the maxilla, here and here. These processes going up from the maxilla at the highest point articulate with the labellar end of the frontal bone and the lateral borders of the nasal bones. If we come down here, we have the mandible. Okay, looking at it from the side, it's a little bit more definitive. This is the area of the body. This is the mental protuberance or your chin. Here we see this region that is actually created by the growth of the submandibular gland called the antegonial notch or submandibular notch. Back behind it is this area where this ramus, this arm, comes together with the body. That's called the gonion or the mandibular angle. And then up here, as we ascend, we see in the posterior aspect of the ramus the condylar neck and the condylar head. And in the front aspect of the ramus, we see the cornoid process. Okay? And then this area between is referred to as the mandibular notch. Sometimes because of its semilunar shape, it's called the semilunar notch. Okay.
First thing that makes sense like that.
On the inside of the mandible, let's see if we can look at it from this perspective here. On the neck of the condyle, there is a depression on the medial side of the condylar neck. That's the pterygoid fovea. That's where the inferior belly of the lateral pterygoid muscle attaches to the mandible. Okay? And when it pulls unilaterally, it usually pulls the mandible to the opposite side. When they pull bilaterally, they protrude the mandible, they translate it downward and forward. Over here, there's where this little pen mark is. This is going into the inferior alveolar canal. And that's where the inferior alveolar nerve branch of the trigeminal mandibular division is going to go. Are you taking pictures of the television?
We're recording it.
No. This is the only lab that won't be recorded. Okay. Oh, so you're recording it as well as video. There's a notch coming down from that opening, from that mandibular foramen. That notch is there because during development of the mandible, a branch of the inferior alveolar is coming down there called the mylohyoid. And this will run down underneath the mylohyoid muscle, which is attached to this ridge here on the inside of the mandible, the mylohyoid ridge. Now, if we look at the underside of the mandible, this is the mandibular border out here. Here's the mylohyoid ridge or mylohyoid line in the front of the mandible. There are little bumps. These, I call them happy bumps, because they're named are geniotubercles or genoid tubercles. And there is an upper tubercle and a lower tubercle. And those are holding on to the tongue, which is being held to the mandible, and to the hyoid bone, which is being held to the mandible. Okay, which we'll be seeing that a little bit later on, both from a lecture perspective and a laboratory perspective. Sometimes when you take a radiograph, I can see one of them here, sometimes between the two bumps on the radiograph of mandibular anterior teeth, because the bumps are a little bit thicker than the space in between, you'll see a radiolucency, and sometimes that radiolucency, or this area of less dense bone, will make you think that maybe there's some type of an abscess going on if it happens to wind up adjacent to the apex of one of the mandibular teeth. So that's sometimes an anatomical artifact on a radiograph that you may see, either on a periapical or sometimes on a panorama. Okay. Let's look at this aspect. This is the skull cap, or the calaveria. And if we look at the calaveria, or even at other aspects of the skull, in particular the mandible, if we would make a sectional cut through it, we would see here a hard, dense bony plate on the inside of the cranium, and a dense bony plate on the outside of the cranium. But in between those two plates is cancellous bone, or trabecular bone, or spongy bone. That's what we refer to as a diploid. That's actually a marrow space. And early on in life, that marrow space is actually a red and white blood cell producer in the young child. So it does serve some, in particular, significance during early life. But that's called the diplo, the D-I-P-L-O umlauts over the E. It's a German word. Before we go into the skull, let's look at some of the bones disarticulated. Somehow there's a lot more life in the human, so I wonder if I can.
It's just a little bone.
Oh. But,
It's the bottom. Yeah, it's just a little bone.
this bone is in the back of the skull. This is how it would sit. This is a portion of the lambdoidal suture. This is the occipital bone. There are bumps in the back of the occipital bone that are referred to as protuberances. Here is a external occipital protuberance here. Really at a line that's called the superior nuchal line, and a inferior occipital protuberance down here at the inferior nuchal line. These are, the nuchal term nuchal means that having a relationship with the neck, or the musculature of the neck. On the underside of the occipital bone, we have some things that are significant both from the standpoint of structures passing through them, but articulations. These structures here are on the left and right anterior aspect of the foramen magnum. Okay, that's a foramen that you should be able to recognize even in your sleep. Okay, coming in through the, and if you can't, just drop out.
She said you should know.
And this area here, this is the base of the occipital bone. From a standpoint of bone growth, this aspect of the occipital bone pretty much is intramembranous in its growth pattern. However, this portion down here and around the condyles is endocondyle. This aspect of the occipital bone that somebody did us the favor of coloring blue, this is the back part of the sphenooccipital synchondrosis. This is the articulation of the sphenoid. Okay. There's some openings that you may or may not see adjacent to the condyles. These are referred to as posterior condylar canals. Sometimes they are only unilateral. Sometimes they are bilateral behind the occipital condyles. But they go from the outside of the skull to the inside of the skull. And they fall into a group of foramen that we refer to as emissary foramen. An emissary is someone who takes information or something from one culture to another, okay? These are what we call emissary veins, a vein that comes from one surface to another. In this case, that surface may be the external surface, in most cases, to the internal surface. So here, it's in the posterior aspect of the external surface, and here it's coming to an area of the internal surface. That would transmit a vein from the posterior scalp into the cranial vault. The issue with emissary veins is they can be a site where some type of venous-borne infection can go from the surface of the scalp into the cranial vault, or vice versa, but that usually isn't as common. In the front of this bone is another foramen that comes under this ridge in the occipital bone on the anterolateral aspect of the background isn't a good color to use here. That comes through this opening. That's the hypoglossal canal. That's where cranial nerve 12 leaves the cranial brainstem, this lower portion of the brainstem, and goes out to innervate structures associated with the tongue. Okay, so that's the occipital bone back there. Let's see. Sometimes we can actually put these things back together. It's kind of like Legos.
So the magic game.
So this is a left,
Use it together.
and this is a right. And the anterior aspect of these bones are articulated with the frontal bone. How we determine the side, and that's something that you have to be able to do with each and every one of these bones, is if you look here, here is the squamosal articulation, the temporal articulation with the parietal bone. If you look at here, we see this more pointed portion of this at the anterior portion of the squamosal suture. This is the front. This tells you this is the front of the parietal bone. So this is a left, and this one on this side would be a right. Okay? And so if we put them together, we would have a left and a right. Okay? So left and right parietal bones. Many times on the parietal bone, you can see back close to the occipital bone, there is a foramen. Here's one here, and here's one here. These are called parietal foramen in the back here. These are also emissary foramen, transmitting a vein from the scalp into a venous channel inside of the skull, which is probably what we call the superior sagittal sinus. Okay, so got the occipital bone, we've got the two parietal bones, we've got a bone that now goes in the front. This is the frontal bone. It doesn't go like this. It goes like this. We are a mammal of upright posture. So this is the frontal bone, both from an external perspective here with the brow ridges. These are kind of flat. This is probably from a female over here. This is a male. But he's not very bulbous, kind of very sharp. So this is probably a female skull. Another one from a little bit smaller, this is definitely a female skull, because we see this very sharp upper superciliary arch or brow ridge, and we see it coming smoothly down into this labella region, which is going to articulate the nasal bones. So this is definitely a female skull. Okay, here we see the different aspects of the temporal bone. we see the flat portion, flat outer portion, the squamosal. Flat portion, the squamosal portion. And coming off of that is this zygomatic process of the temporal bone with the this area that we call the articular tubercle out here, this bump, and the articular eminence here on the inside. External acoustic hiatus, mastoid process of the temporal bone. This is the mandibular fossa, where the condyle and the articular cartilages would come into play. Over here on the inside, once again, that fissure, not simple round foramen, but a fissure, that's the petrotympanic fissure. That's the petrotympanic fissure. Over in the inferior aspect, here is the mastoid process. There is a groove on the inside called the mastoid notch. There would have been a styloid process right here. This is a stylomastoid. That's where the facial nerve proper exits the skull. And then, as we come up a little bit farther, this is a portion of the wall of the jugular foramen over here. And then just in front of that, we usually find an opening, an external opening into the carotid canal, right here.
DNA.
If we look on the front, we see a couple things. The carotid artery, internal carotid artery, would be passing through this groove or this area right here. And immediately adjacent to it, let's see if you can put this in here. Immediately adjacent to it, this paper clip, that's the auditory tube. Okay, so we've got this area of the carotid canal, and adjacent to it we have the auditory tube over here. On the inside of the temporal bone, there is a opening in the inside surface of the petrous portion. This is the interoacoustic meatus, and then this is the internal portion of the squamosal portion of the temporal bone. Then in the front, on the top of the petrosal bone, is a opening for an anterior branch of the facial nerve. Right here, this is called the hiatus of the facial canal, or the facial hiatus. This is where the petrosal branch of the facial nerve exits the inner ear.
Just like me. That's cool.
It's right here in this anterior aspect. Okay.
This skull is kind of narrow, you know.
Is this stuff we can see on our full skull? Like,
And in the sphenoid bone, we have some wings. This is a greater wing here. We can see the greater wing in the whole skull as well. Here in the middle cranial fossa, we can see the greater wing. Here on the lateral surface of the skull, we can see the greater wing, especially if someone colors it red. And then in the orbit, we can see the greater wing. So if you look at it, it's kind of a pyramidal shaped process coming off of the sphenoid bone. So that's the greater wing. The lesser wing on top, running over the top of the superior orbital fissure. Okay, you see the wing-like, almost bat-like shape of it. Also, it is covering over the top of this opening. That is the optic canal that is coming out forward into the orbit. Other structures that we can see coming into this area we call the pterygopalatine fossa. This is the foramen rotunda, the round foramen. And then back behind that is an oval-shaped foramen, the foramen ovale. All of the cranial nerve branches, once again, are divisions, go through openings in the sphenoid bone. This area on the top of the sphenoid bone here, that's where the pituitary sits. It's called the sella turcica, the Turkish saddle.
You didn't catch it.
On the inferior aspect of the sphenoid bone, here in the anterior aspect, there's a protrusion, which is going to articulate with the back of the ethmoid bone and the back of the boma. This is called the rostrum, the nose of the sphenoid bone. Okay? And then alongside of the rostrum, once again, we can see an opening here. That's the foramen rotundum. And then there is another opening just medial to the foramen rotundum, which we haven't talked about yet. This is the anterior aspect of a canal called the pterygoid canal, the Vidian canal. Okay. And that is where a combination nerve goes through, a combination of the postganglionic sympathetic, it's called the deep petrosal nerve, and the greater petrosal nerve that form this nerve called the nerve of the Vidian canal. These structures coming down here are lateral and medial pterygoid plates, which are extensions of the sphenoid bone inferiorly. In the back of the sphenoid bone, we can see this region here, this pterygoid fossa area here, with the lateral plate and the medial plate, creating its medial and lateral borders. But at the top of this, once again in the back, is the posterior extent of this pterygoid canal. So if we pass this pipe cleaner through, we can see that it goes through the front and the back of this pterygoid canal. We'll talk about this more when we get deeper into the head. Okay. Here we've got a bone that I think you're well aware of. That's an adult maxilla. And look at this little guy. What do you think this is? Is this an adult? Okay. And is there just one bone here, or are there two bones? Okay, right, there's two bones here. Here's the zygoma with a zygomaticofacial foramen, and here's a maxilla. This is a deciduous, these are deciduous teeth. The deciduous second molar hadn't erupted yet. The deciduous first molar had erupted, and we've got a, the deciduous first and second molars are here. The canine tooth is here, but the central and lateral were broken off. The permanent first molar has yet to come out of its crypt. So approximately how old was this individual, this child, at the age of its death? How old? 5? Could have been 5. That would have been at the latest extent. Okay, because if the first molar had been erupted, then it would probably be at least 6. So, but it's probably somewhere between 2 and 5. Okay, because very little formation of the molar at this point in time. So that wasn't ready to erupt at any time soon. Okay, in relationship. Okay, we've got this little guy here. I think we got a pair of these. See if we can find the other one.
That screen. So much easier. So what's that screen? My head hurts looking up, so it's better if I look
Okay, what do you think these bones are?
Oh yeah, that's what I got.
Okay, these are palatine bones.
Oh,
This is the back of the palatine bone. This is called the posterior nasal spine. Back here, this pointed process. Let's see if I can make figures out of it. That would look good. Okay, back here. And then this anterior aspect is where it articulates with the maxilla and also with the pterygoid plates of the sphenoid bone. And then this little process up here on top is called the orbital process. We'll see when we talk about the orbit that one of the bones that helps form the orbital chamber is the orbital process of the palatine bone, and that's this portion right here, sticking out. These actually are not real bone. These are actually some type of plastic alloy.
no. What
Okay, we have some inferior concha here. Okay, for your benefit in terms of identifying them, unless we get another set, these are both left. Okay, there is a lip of bone that comes over laterally to articulate the maxilla. I told you from the standpoint of the shape of this bone, it kind of looks like a sailfish to me. What it looks like to you, I can't tell you. Okay, so this is the front, this kind of bulbous portion out here. Let's see if we can zoom in on this. Okay, this is the front, the anterior portion. This pointed portion is the posterior aspect of the inferior concha. And this lip of bone over the side is a lateral process that articulates with the maxilla. Here we have a zygoma. Okay, with its frontal process here, its zygomatic process here, and its maxillary process here. And this has a zygomaticofacial foramen coming through it right here. Okay, looking at a couple other bones, then we look at these foramen in the whole skull. What's that bone? What do you think that bone is? Someone said hyoid bone. Okay, not an infant mandible. This is the hyoid bone. This is its body. This is its greater horn. The lesser horns are at the corners. This is actually real bone. This is real hyoid. These bones right here. These are nasal bones. The wider portion of the nasal bone is down its inferior aspect, which is down here. This bulbous portion articulates with the frontal bone up here, and the lateral border articulates with the maxillary process, the frontal process of the maxilla up here. Okay, so these bones are in this bone box, both this large bone box and this small bone box. The bone boxes are in the laboratory in a cabinet that's labeled bone box. What a funny name. So you can look at those bones in the laboratory, okay? But you can't take that box out of the laboratory, okay? Replacing a skull is expensive enough. Replacing a bone box is about $3,000. Okay? So I know, you pay a lot for tuition. You really don't want anything else on your statement as you're going on. So be sure that, and also from the perspective that, these are things that you're sharing as learning tools. So be respectful to your classmates from that aspect. The large bone box, the same thing. All of these large bones are in there, so just use it when you're in the laboratory. The skulls on the glass cabinet in the laboratory that is above.
Okay.
Okay, we talked about these areas here, adjacent to the foramen magnum. This skull, by the way, only has one posterior convoluted canal. It doesn't have one on the right side. This would be the right side over here and the left side over here. It does have a hypoglossal canal. Coming in underneath the condyle. This is a different height thing. Okay, so this is a hypoglossal canal. Hypoglossal nerve will be coming off of the brainstem, adjacent to this structure we call the olive, or olivary nucleus. Here is a styloid process here out to the side of that, and between the styloid part, you can't see it. Can you see it here? Okay. Here is the stylomastoid foramen. The facial nerve proper exits that foramen. Here is the jugular foramen. Here. And just in front of the jugular foramen is the external opening of the carotid canal, where the internal carotid artery enters the skull. Not the external carotid artery, but the internal carotid artery enters the skull. Now, there's another opening here that you need to know that lies between these two foramen. And as small as it is, it's still a rather significant structure, or a significant opening. This opening lies on a rigid bone that lies between the jugular foramen and the external opening of the carotid canal. Is that true? So let's see if we use the other end. Okay, that's called the inferior tympanic canaliculus. And that is transmitting a branch of the glossopharyngeal nerve that is the autonomic component that's going to eventually innervate the carotid gland. This is going to be its lesser petrosal branch of the, the glossopharyngeal nerve. It's going to innervate the carotid gland. It's going to actually go through this opening, pass adjacent to the middle ear chamber, pass out of a slit in bone adjacent to the facial hiatus, and then go down and synapse in that otic ganglion that's sitting on the medial side of the mandibular division of the trigeminal nerve. So tiny but powerful. As we come forward here, we have an opening. Let's look at it on this side. Here's the carotid, the external carotid opening. Here is an opening. This little spike of bone right here is called the sphenoid spine. This opening that is adjacent to the sphenoid spine is called the foramen spinosum. The middle meningeal artery goes through there. On the medial side of these two openings, there is a foramen here that is called the foramen lacerum. Now, some authors say there's nothing that passes through the foramen lacerum. I don't know how this got started, but obviously it got started a long time ago. That's not true. There is a significant nerve that comes down, passes into the carotid canal. We'll look at the inside aspect of this in a little bit, where this greater petrosal, preganglionic, parasympathetic branch of the facial nerve joins a nerve called the deep petrosal, which is from the postganglionic distribution from the superior cervical ganglion, the posterior postganglionic sympathetic. So the greater petrosal joins the deep petrosal, and they form a nerve which comes from the inside and goes out, and then turns forward into an opening here that we saw on the sphenoid bone, which is the posterior opening of the pterygoid canal. Okay, so this is, those two nerves come together to form a nerve called the nerve of the pterygoid canal, or the Vidian nerve. So that's on the inferior aspect of the foramen lacerum. So in order to get there, this nerve has to pass through it. Now from below, there's actually an arterial vessel that many times goes in here into the middle cranial fossa to supply some of the dural surface in the middle cranial fossa. And this is called the meningeal branch of the ascending pharyngeal artery. So that actually goes through here as well, but from the opposite direction. We see over here the pterygoid plates. The pterygoid plates are key to this opening because they are forming, at their roof, they are forming the base of this area, this Vidian canal. There are some canals that are tiny that, although they're significant, we don't talk about them much, but these are called these are called pharyngeal canals. These underneath the vomer, here and here, are called vomerovaginal canals, under the vaginal process of the vomer. So these are nerve branches that came from the maxillary sphenopalatine portion into the pharynx. This area in here would be the pharynx. And these nerves are supplying the soft tissues of the pharynx, okay, as branches both from the maxillary nerve, but also from the secretomotor fibers from the facial nerve that are coming from that pterygopalatine ganglion. This posterior aspect here, we're looking into the posterior aspect of the nasal chamber. With this bone here, this is pretty much all vomer that is helping to form the bony nasal septum. You don't really see the perpendicular plate because that's farther inside and farther forward. Alongside the pterygoid plates is a oval-shaped foramen. So what would you call an oval-shaped foramen? Jeez, what a hard structure that is to figure out. So that is where the mandibular division of the trigeminal nerve is entering and exiting the cranial wall. Okay? As we go farther forward here, we see some structures on the maxilla. Externally, we see here, this is the lateral pterygoid plate. This is the tuberosity area of the maxilla. This opening here is referred to as the pterygomaxillary fissure. pterygomaxillary fissure. Now we can pass this pipe cleaner through the pterygopalatine fossa and through that medial opening or that medial window called the sphenopalatine foramen. So out here would be the infratemporal fossa, in between here would be the pterygopalatine fossa, and in here would be the pharynx. So we've got this long fissure, which is a doorway from the infratemporal fossa into the pterygopalatine fossa, and a window into the pharynx from the pterygopalatine fossa. Okay, where branches of maxillary nerve and the facial nerve postganglionics are going. On the tuberosity aspect of the maxilla, let's see it here because of the teeth are still present. You can see a groove here going into a foramen and another opening here going into a foramen a little bit larger. This is a groove for the posterior superior alveolar nerve. Posterior superior alveolar nerve, the nerve that innervates the molar dentition in the maxilla. This opening is for the posterior superior alveolar artery. And we'll talk about these again when we talk about the maxillary artery and the infratemporal fossa. So those are in the tuberosity area in the maxilla. If we come around and put the skull down, looking at the palate, the hard palate, we can see some openings in the hard palate as well. This is the palatine bone. Can you see that? Okay, here's a small opening back here. That is a lesser palatine foramen for the transmission of lesser palatine nerves and vessels. And then in front of that, there's a larger foramen called the greater palatine foramen. And those nerves are communicating with the infratemporal fossa region, and the vessels are actually also communicating with the infratemporal fossa region. I'm sorry, the pterygopalatine fossa region. In the front here, we have the incisive canal. I don't think this goes all the way through, but it is actually a bilateral canal. It's on each side of the nasal septum. So that's the incisive canal, or another name for that is the nasopalatine canal. Okay. So what you need to know over the weeks and days of this course is you have to learn all of these foramen, where they are in the skull or on the individual bones, and you need to know everything that goes through them. Okay. And as I said, you may think, well, that's being kind of picayune, Dr. Landers. Well, you're going to be dental practitioners. And if I thought it was picayune, I wouldn't ask you to do it anyway. But by understanding how these nerves run through the skull, how these nerves go through the skull and then innervate soft tissue structures, is how you get the knowledge that you need to basically differentially diagnose the problems that your patients are presenting to you with. And it's not just tooth decay. So you can, we'll be here another hour, and we'll be walking around the room and helping you find some